Hello, everybody, and welcome to Preregshortcuts. Hello, everyone. If you can hear me clearly and if you can see me, please type a yes in the comment section. Please type a yes. Let me make sure you can all see me. Let me make sure you can all hear me. Type a yes if you can see me. Please type a yes if you can hear me clearly. Great. Sorry about that. There's been a slight delay in transmitting some of the responses. So I couldn't see your comments before. I was wondering if you guys could actually hear me, but it looks like you can. So welcome, Iridina. How are you doing? Great to have you on. Alexandra, fantastic. Great to have you on. Chloe, Samia, great to have you. Danok, great to have you. Ophon, great to have you as well. Coco, Samia, how's everyone doing today? Please type in the comments where you're dialing from. Let me know if you are a trainee pharmacist or if you're a pharmacist. Just put down the comments. Let me know where you're dialing in from today. Today, I've got a very exciting session for you. We're going to do this for half an hour. And then I've got another session with the trainees on the Preregshortcuts Training Programme from 8 o'clock to 9 o'clock. And it's all about focusing on BNF updates today. So it's very important that in order to be an effective pharmacist, in order to be an effective healthcare practitioner, you need to be up to date. You need to be up to date with all your clinical knowledge. So today's session, it's about doing that. Today's session is giving you the updates so that you're fully equipped like we do on the course and you totally smash your exam as well as practice effective as a pharmacist. So great to have all of you Samia, UK OSPAP students in the house. Great to have you, Samia. Dan is a trainee. Wow, so we've got lots of trainee pharmacists on here tonight. We've got a student, Iridina, welcome. That shows a lot of passion. A student on here. You could have been anywhere tonight, but you're here with us. So well done for joining in. Aberdeen trainee pharmacist, fantastic. Great to have all of you. For those of you that don't know me, those of you that are here for the first time, my name is Marvin Munzo. I'm a pharmacist. The co-founder and the clinical lead of Preregshortcuts, which is our trainee provider. We currently train 1 in 4 trainees nationwide, and we've been going on for about 7 years with excellent reviews. So we've got a course going on at the moment. So I'm going to do this very quickly with you. I'm going to go through some of the updates. As you can see, there are so many chapters. There are so many updates. There are updates from chapter 1, updates from chapter 2, chapter 3, chapter 4, chapter 5, chapter 6, chapter 9, 10, and 14, and also the appendix. So I've got all of this today. So you can imagine we don't really have as much time. I cannot possibly go through all these updates in the limited time we have. But for those of you on the combo course on the foundation, our foundation program, as soon as this finishes at 8 o'clock, we're going to continue this because today's session on the course is all about updates. So I'll continue the rest today. So are you guys ready for a great session tonight? If you are ready, type a yes in the comment section. 70 of us on here, fantastic. Jazz Shagil, with this session be available for us later. So yes, this will be on YouTube, but this is not going to be the full session. This is going to be part of it. The rest of the session, I will have to continue this with those of you on the combo course. So if you're not on the foundation program, you will benefit from what we do now. But those of you that are on the foundation program, we will continue the entire update and you will have all the slides on our foundation program. So great. Are we ready? I'm getting lots of yeses. Great stuff. We've got lovely slides for you that have so much information. So let's go straight in. This is what I'm excited about. So here are the updates I have for you today. So as you can see, there are quite many of them. So obesity, massive update on obesity. Hypertension, always updates on hypertension. And it's always changing. There's always something to learn, something that's changing. Nice guidelines with your hypertension guidelines. Heart failure, major updates as well. Statins, which are all high weighting areas in your GPA's exam. DOACs. DOACs is a big one. Your Rivaroxaban, Doxaban, Apixaban, Dabigatran. Recently, I attended the show, the Clinical Congress in Manchester. So this was about 2 weeks ago. And there was a session, and this session was so packed. There were so many people. I was wondering, why are there so many people on this session? What is this? I was so curious to find out, because all the seats were taken and then you had so many people standing. And when I walked on to find out what it was, guess what it was? It was a topic on DOACs. So it shows you how popular your anticoagulants are, your DOACs, your dabigatran, your roxaban. So we have very interesting updates on this chapter as well, or this drugs, or this topic. Angina updates, asthma and COPD. Always get questions in your exam, and as pharmacists, we always have to improve our knowledge when it comes to asthma, COPD. Respiratory system, BNF 3, chapter 3. Adrenaline, there are some updates on the use of Emerald and a few devices that we're going to go through. For Buxostat, yes, another drug for gout. Interesting updates on this medication, just like allopurinol, but for Buxostat, there's a very, very interesting update on this medication. A very important group is your antidepressants, your SSRIs, very popular. You dispense this probably frequently in your pharmacies, and also you get tested on this quite a lot in the exam. There are some updates on SSRIs we're going to look at, and then antiepileptics. Cannot stress, there's always an update when it comes to your antiepileptics. For the past years, it's always been on valproate, loads of updates on valproate for the past years. There's also been an update on the epilepsy guidelines on the management of epilepsy, updates on certain drugs such as lamotrigine, and then pain. Loads of updates as well. Pain management, tranexamic acid, methylphenidate, buprenorphine, ibuprofen. Ibuprofen is quite important because this is one drug that is so common. We're going to look at the updates with ibuprofen when it comes to pregnancy. So this is one that you definitely want to learn. Very important. OTC, dispensing, pharmacists, very important that you stay up to date with the updates on ibuprofen. Also updates on codeine, full codeine linctus, then hyoscine hydrobromide patches, antibiotics. The big chapter, ladies and gents, that's the chapter I also get excited about. Chapter 5 of your BNF, infections. So there are very, very, very important updates in this chapter, specifically for certain drugs, such as groups of drugs like quinolones, so your ciprofloxacins, etc. Nitrofurantoin, very important one. I'll go through an important update. Erythromycin, another common antibiotic, especially for those that are allergic to penicillins, and then azithromycin. There's also been an update in malaria. So your guidelines, what we had even on our combo course notes previously, these have been updated. Updates, metformin, testosterone updates, diabetes. So this is not something that's happened this year, but that's a very important update that you have to make sure that you're fully aware of the updates on diabetes. Calcium chloride updates, and then some updates on your vaccines, and then also your appendix, the back of the BNF. Some appendix have been taken out while others have been added into the BNF. So some of these changes and updates I have for you are not even in your current BNF. Some of these changes have literally happened in the last few months. So if it's very difficult to do an update session, and the reason why it's so difficult is because this very moment, as I'm doing this with you, there could be an update taking place tomorrow. So an update is something that's continuous, and that's why in the combo course, we have to do this continuously. So you always have updates posted on the website whenever these updates come up. So learn what you can today, but please keep an eye, make sure you're fully up to date because these things change all the time. So there's quite a list, but today we're going to start doing some of these. We'll see what we can cover. Probably start with chapter 1 or start with obesity. I'm going to make it easy. I've broken it down into your BNF chapters. So I'm going to go through all the updates, the most important updates in your GI system. Then we're going to move on to cardiovascular system, then respiratory system, then CNS, then infections, then endocrine. So we're going to do it in that order. So let's get going. Who's excited? Who's excited to learn these updates? Type on me if you are excited tonight, as excited as I am. If you're as excited as me, please type on me. With a session 8 to 9, someone's writing with session 8 to 9 on the website be recorded for us to watch again. So if you're part of the training program, you're part of the combo course, if you're part of our foundation training program, absolutely, you have access from 8 to 9. You have access to all the slides. You have access to everything, okay? If you're not part of the course, then just enjoy this moment. right, on YouTube. I'm going to go through some of these slides. Okay, let's get in. So the first one I'm going to look at is chapter 1. There is a very, very big update on obesity. And you want to learn this update. So if I ask you this question, what are the 3 drugs that are recommended by NICE for obesity? Or what are the drugs? What drugs do you recommend as a pharmacist for obesity? What do you dispense? If a patient was to come up to you and say, what drugs are out there, or what are the recommended drugs by NICE to treat obesity, what are you going to say? Just put your answer down, interact with me. If you don't know, put a 0. That's fine. If you know, put it down so you can make the 1. Again, we're doing this now, but from 8 o'clock, we're going to continue on the combo course. So in terms of your update to obesity, I've got Wegovy, fantastic. I've got Ramoses, Saxenda, great stuff. You're all doing well. Yes. So previously, we always had the number 1 or the only recommended drug for obesity used to be Orlistat for a very long time. But now there are other drugs that have been added. Someone puts Senna, no. So according to NICE guidelines, and this is so up to date, this was literally 2023. I think this was finally concluded in July, but this is this year. So there has been updates on pharmacological interventions when it comes to treatment of obesity. And NICE has literally focused on or recommended only 3 treatments. So the only 3 drugs that are recommended for obesity. One of the ones that's been taken out that used to be there is naltrexone bupropion or bupropion. So that has been taken off. Brand name Misimba. That has been taken off. Not taken off, but it's not recommended by NICE guidelines. So we have to focus on the most up-to-date NICE guidelines. So according to NICE, these are the 3 recommended drugs for weight loss. So you have Orlistat, liraglutide, specifically Saxenda, which you guys have put there, very good, and then semaglutide, which is Wegovy. So some of these happened last year, 2022, but this guideline was updated in July 2023. So that shows you how recent this is. Okay, so these are the 3 recommended drugs for obesity, for weight loss. Could there be a new drug by tomorrow morning when we wake up? Absolutely. But for now, according to your latest guidelines, these are the 3 recommended medications for obesity. Now, there are certain important things that you need to learn. Now, anyone, as you guys know, obesity increases your risk of getting your cardiovascular diseases, risk of hypertension, type 2 diabetes, cancers, you name it. So by using these drugs, you reduce the risk of getting these chronic conditions. So these 3 have been tested to see how they perform. Now, of all of these drugs, obesity semaglutide, which is one of your newer ones, you cannot use this on their own, by the way. They have to be part of your whole weight loss program. But semaglutide, which is a GLP-1 agonist, has been shown to decrease the risk of cardiovascular disease and more weight loss with this drug compared to Saxenda. Okay, so compared to liraglutide, you get more weight loss with semaglutide. It's important that you at least learn Wegovy, which is your semaglutide, learn about Saxenda, which is your liraglutide, and Orlistat as the 3 main drugs for obesity. So I have here, you get this in more detail. You probably see this better once I send you guys the slides on the course. But important things you need to learn. And this is a table that has been done by NICE, which I find very, very good. But what they've done with these 3 drugs that they recommend, they've literally analyzed them. They've got a table where you could see the starting criteria. So you could see the criteria for each drug, as well as when to stop the drug. So the probably the easiest of all of them that has less starting criteria is your Orlistat. But as you can see with the other drugs, you normally start them from a higher BMI compared to Orlistat. So again, we're going to give you all of this from NICE guidelines. This is recent. This is July 2023. And you have the details of each drug, when to start them, starting criteria, as well as stopping criteria. Great. So can you guys see that? I will send you guys into combo course the full slides. Now, this is another thing, another change that's happened, which is pretty recent. And most people are not aware of this. If I ask you this question, if I'm a Black African, what is the range for overweight? BMI. Can anyone answer that question? What is my range for being overweight? What is the overweight range? The BMI overweight range. From what point are you overweight or considered overweight? Anyone? So again, we need to know everything about obesity. We need to know about the medications. We need to know side effects of those medications. We need to know about all the counseling advice that goes with them, patient care advice. So in this case, a straightforward question: what are your ranges? So when I talk about overweight, what range are we looking at? What is a healthy BMI, and what BMI is considered as overweight? So EWIDA says from 25 kilograms meter square to 30. So I've got 25 to 30. Okay, great. So for most of you, you would have learned 24.9 or 25 to 30, right? Overweight, 25 to 30. So great. Aliyah says 23 to 27. So what has changed, which you need to learn, is that recently it's been found that certain groups of patients, Black Africans, Caribbeans, South Asians, Asians generally, Chinese, certain groups, non-white groups, have a higher risk of getting chronic conditions at a lower BMI. So because of that, the BMI has been lowered for certain groups by about 2.5. So where we used to have 25 as the starting point for overweight, this is true for Caucasians, this is true for white groups, but not for other ethnic groups. Because other ethnic groups like myself, I'm Black African, I have a higher risk of suffering or getting these chronic conditions at a lower BMI than 25, so 23. So 23 becomes my overweight limit, right? So that's my range. So now this ranges that you've learned all this time, which has just been standard range for all groups, these have been divided. So you've got the range for Caucasians, for white groups, and then now you have the range for other ethnic groups. The reason is because we just have a higher risk. We probably have more fat in our midsection, so central adipose of tissue. And because of that, we have now this on NICE guidelines. If you look at your latest NICE guidelines, you will see that you have your ranges, which are your normal ranges that we've always had, but these ranges are now for white ethnic groups. But for Black Africans, Black Caribbeans, South Asian, Chinese, Asian, Middle Eastern families, the BMI, they have a different range. So overweight now is from 23 to 27.4. Okay, and obesity is from 27.5, no longer 30. So please learn that distinction and make sure that you're up to date with this. Is this clear? Give me one, type of one. If you're still with me, type of one, type of one. So your ranges, you have ranges for white groups, and now you have ranges for other ethnic groups. So it's important you know about this recent NICE guidelines. Also with obesity, there's been an update with your surgery. So your bariatric surgery goes back to the same thing. So all of these ranges that you've learned, and you've only learned one standard range for everyone when it comes to obesity, this has changed. Okay, there's a different range for other ethnic groups. And the best way to remember it is most ethnic groups are about 2.5 kilograms per meter square less. So about 2.5 less than what the white ranges are. And that gives you an idea of what's going to be. So for instance, again, as we're saying, for a Caucasian, overweight is from 25 BMI, but that's not going to apply to a Black African like myself. It's going to be 23. Great. So very important. Learn that. Next thing we're going to look at, let's go to chapter 2. So with the chapter 1, We don't have so many updates, which is quite good, And in your exams, this is just a medium weighting chapter, very important. But generally, you don't get as many questions from chapter 1 of the BNF. But you do get so many questions from chapter 2. And as a pharmacist practicing every single day, most of the medications you probably dispense are cardiovascular medications. So let's go into chapter 2. Are you guys ready for chapter 2? Type of 1, we have loads of updates in this chapter. I think this chapter and the CNS have the most updates. But let's do some of this chapter. Okay, so chapter 2. So let's go straight into hypertension, because I know most of you provide this service. Very important. Learn everything you can. So let's look at this. So the first update. So this was last year. This wasn't this year. This was last year. So there's an update in terms of targets. Loads of changes in your target ranges. So previously, our standard. What is the regular target for hypertension? Clinic. So clinic, blood pressure, hypertension. What is the value from what is the hypertension value? From what point do you say this is hypertension? What is the value? Type in the comments. Let's see. Hypertension, what is the definition? Give me the clinical. Great. Irida, fantastic. I've got 140 over 90. I've got 140 over 90. Ramu, I've got 140 over 90 by Dan. So let me ask another question. So Dan, if a patient had a stroke, if someone's got any cardiovascular disease, what is the hypertension value then? So if someone has got a stroke, or if someone has got some sort of cardiovascular disease, they've got a stroke, or maybe they suffered from some angina, TIA, what will the value be for them? So in the past, people have always used a lower value. They've always gone down. Most people have gone to 130 over 80 for someone that's got hypertension but has had a cardiovascular event such as a stroke or a TIA. But recently, research shows that you don't need to do this. And according to NICE guidelines, you should use the same, right? So whether someone has had a stroke in the past, whether they've got any cardiovascular condition, it doesn't matter. You still use the same range, which is 140 over 90. As long as it's below 140 over 90, the patient should be fine. So that's what this update was all about. We don't need to use 135 over 85 or 130 over 80 for anyone that's got a stroke or TIA with hypertension. It's fine to still use the same value, which is 140 over 90. Is this clear? Type of 1 if that's clear. So that's quite straightforward. Very easy one to remember. Now, if you go into your BNFs and on the combo course, we always update all our notes, as you guys know. So this is going to be all updated. Your ranges. So we have stage 1 hypertension, stage 2 hypertension, stage 3 hypertension. So if you look on there, we used to have stage 1 previously used to just be 140 over 90 to 160 over 100. That has changed. They've updated that, which is good to know, finally, because I was asking, when are they going to update this stuff? So it's actually 140 over 90 to 159 over 99, which makes it easy because now for stage 2, we can start from 160 over 100, and it has to be less than 180 over 120. So these are just changes which you're going to see in your BNF now. If you go to your BNF, it's different from the BNF you had last year. It's been updated. It's no longer just 160 over 100 as the end stage for stage 1. It's actually 159 over 99. Another thing, you guys may not be able to see this clearly, but again, all of you on the course, combo course, you're going to have an update table with all your hypertension targets. So I'm not going to go through this whole table. As you can see, you need to know your type 1 diabetes. So anyone that's got type 1 diabetes with hypertension, they've got different clinic targets. They also have targets for when you can start offering or prescribing antihypertensive treatments. Some of these are from NICE and SIGN guidelines, but this is the range. These are the different values. ACR is your albumin, your creatinine ratio. So you have all of these values that have changed in your BNF, which you need to learn. Again, we're going to send this to you, all of you in the course, and you'll be able to learn this stuff. Great. So please remember that your targets have changed. When will this video be available on the combo course? So as soon as I finish 8 o'clock, we're starting another session on the combo course. Every Monday, we have the clinical session. Today's session is on all your updates. So all these updates, I'm going to continue at 8 o'clock, or it's almost 8 o'clock. And I'm going to go through all the slides. There's so much for us to cover. It may be an hour and a half. It may even be 2 hours. But it's quite a lot of things for you to learn. Okay, metolazone. This is an old update. I'll say some last year, but nothing much to worry about this because it's not as common. So this is just a diuretic, but there's a specific brand of this diuretic, which is Zaqua, or however you want to call it, Xaqua. I call it Zaqua because it sounds all right, Zaqua. So all this update's about is this specific brand is not interchangeable with other metolazone brands, okay? Because you get a lot of it in the blood, all right? Very high bioavailability. So the main guidance is do not interchange Zaqua with other metolazone brands. I'm on the combo course. How can I have this video? If you did not join the combo course and you have the video, but I'm still giving you some here. Okay, I think I'm going to have to stop on this one. Something has happened to the slide because that's probably moved around a little bit when I uploaded it. But this is an important one, heart failure. So you do get a lot of questions on heart failure in your GP's exam. Also, it's important that you learn about heart failure as a pharmacist, as a healthcare professional. You will come across many patients that are taking medication for heart failure. So we always had this guidance for heart failure, which we've always used. And on the combo course, we go through a lot of medications. We talk about your MRA drugs. We talk about beta blockers. We talk about ACE inhibitors. We go through all your specialist ones, your sacubitril and drugs like that. So we do all of these. But an update that happened recently was the addition of dapagliflozin, 10 milligrams. So dapagliflozin is... What is dapagliflozin? Let me see. What group of drugs is dapagliflozin, guys? Please let me know. What is dapagliflozin? What group of drug is it? Dapagliflozin. Please, guys. What group of drug is this? Dapagliflozin, SGLT2 inhibitors. Thank you very much. Well done to all of you. Tabor, fantastic. So it is an SGLT2 inhibitor, and these are normally used for diabetes. These are normally diabetic medications, but this specific drug can also be used for chronic heart failure. And of all your SGLT2 inhibitors, there's only 2 of them. There's only 2 that are licensed for chronic heart failure, and you need to learn those, okay? Dapagliflozin is the most common one. What's the brand name? What's the brand name? In your pharmacy, what's the brand name for dapagliflozin? So dapagliflozin is the most popular one, and you got empagliflozin. So when you look at the guidelines, you need to add these drugs to the guidelines and be aware of them in treating chronic heart failure. So you may see this even in an exam. You may see this in your pharmacy. The moment you see this drug, do not automatically think metformin or think, oh, that's it, it's for diabetes. All right, it's because it can also be used for chronic heart failure, but it has to be in addition to other medications. So let me show you how recent this is, how up to date this is. Let me show you how up to date this is. So nice. This is 18th of May, 2023. This is the 18th of May. So I think by this time, even your BNF was probably already done, right? Your hard copy BNFs. So 18 May 2023, the NICE issued its final draft guidance, which recommends that Forxiga, which is dapagliflozin, as an option for adults with symptomatic chronic heart failure with preserved or mildly reduced ejection fraction. And it's so interesting because it says here dapagliflozin is the first NICE recommended treatment for this type of heart failure. So it's important that you know dapagliflozin, the 2 drugs that are used. Correct, Zovida put Forxiga. Thank you very much. All correct. Well done, Oluremi. So it's important that you know that this is used for heart failure as well as empagliflozin, but just these 2 are licensed. SGLT2 inhibitors, only these 2, okay? So great stuff. Please make sure you're up to date with that. Now, on our combo course, these are some of the slides I had on the combo course notes, on our course notes. So as you can see, we've always had a short diagram that I showed you guys how this works with your heart failure with reduced ejection fraction. We always went through this diagram in terms of the algorithm. But if you look at the bottom right in green, I've added new dapagliflozin, empagliflozin. It has to be 10 milligrams and it's once a day. So these are the two drugs that can be used for heart failure, but they're only used as add-ons. So you cannot use them on their own. They only come towards the end. So when you've tried the other drugs, when you've tried your loop diuretics, when you've tried your ACE inhibitors, you've tried your ARBs, you've tried your MRAs, you've tried the other drugs first. And then dapagliflozin or empagliflozin can be used as specialist addition drugs to the current medications the patient's already taking. Okay, so they're not used initially on their own, they're used as add-ons. Okay, so I think, wow, I still have a lot more. I think I'm going to stop there. I'm going to say we have quite a lot. We've got statins, we have DOACs, but we're going to stop here because I've got a class right now with the combo course trainees. Stay tuned. Stay tuned. Every Monday, we're going to have a session from 7:30 to 8 o'clock. It's just going to be a session just to give you guys some updates on what's going on or some calculations, some topics before our class starts at 8 o'clock. So those of you on the combo course, please jump on there. You all have the link. Jump on the course. We're going to continue with these updates. We have a lot of updates to go through. All right, ladies and gents, have a lovely evening. This is going to be on there on YouTube. So this is going to be on YouTube. You can definitely watch this. Give us a call if you want to join the course. If you want to learn more about the course, just give us a call. You can book a call with us on WhatsApp. Go to our website and you can message us on WhatsApp from the website. And if you have any questions, we have to answer them. But I've got to dash off with the rest of the group to continue this. Okay, have a great evening. And we're going to continue learning these updates. Take care, everyone. I look forward to see you all soon. Bye.